So starting out with this slide, we're looking at common diseases and disorders of the musculoskeletal system. And what you'll notice in the top picture there is arthritis. This is osteoarthritis, and when we refer to our medical terminology, we're going to think of itis as being inflammation, arthro is joint, and osteo is bone. So this is an inflammation of the bones and the joints, typically caused by your day-to-day wear and tear on the body. Over time, remember I mentioned that there's a fluid that's within the joints. Over time, the joints become stiff, that fluid becomes almost non-existent. And unfortunately, what you're going to see is the degenerative joint disease, or DJD. That's very representative of this photo here. Not to be confused with rheumatoid arthritis. Rheumatoid arthritis is autoimmune. And so this is caused by its own body that happens. It is an inflammatory disease. It's chronic. Chronic means that it's something that occurs over a period of time. And what it causes over time is visible joint deformity. And that's what you can see in the lower picture there. The term autoimmune means that the body is essentially attacking itself. And unfortunately, the inflammation is what causes this joint deformity. So we have osteoarthritis, wear and tear, rheumatoid arthritis, autoimmune. In our common diseases and disorders, we also have bursitis. And in the picture there, you can see a case of a healthy bursa versus bursitis. Bursitis, itis, inflammation. And this is inflammation of the bursa. So you've got a healthy bursa here. And over time, it becomes inflamed. And as it becomes inflamed, it's going to cause issues with mobility, may cause pain within the joints, can be relieved over time. Ewing sarcoma, we don't have a photo for, but that's a tumor that forms in bone or soft tissue, and the age is between the ages of 10 and 20 years old, so very young there. And then in the photo to the right, we have gout. Gout occurs from crystal. It's uric acid that crystallizes within the joints. You might have heard it referred to as the rich man's disease, and that's because it has an association to cheese, wine, and red meat. So a diet that is high in those components tends to lead to the buildup of uric acid crystals, and occurs for some reason within the big toe, the joint in the big toe. It's where we typically see gout. So because of the uric acid, they are like little rocks that kind of build up in that area, going to cause pain with mobility. Redness and swelling would be very typical. Wrapping up here, we have osteogenesis, which is brittle bone disease. This is hereditary. Osteoporosis, very similar to osteogenesis. What you will see is that with both, these are the cells of the bone. And so with a healthy bone, what we would expect is to see all of the bone cells compact, creating a density in the bone, making the patient less at risk for accidents. With brittle bone disease or with osteoporosis, notice that that density starts to create these larger holes. Over time, the holes get bigger. That allows for space within the bones, changes the amount of density that the bones have, places the patient more at risk for injuries, fractures, breaks, could cause softening in the spine, which could make the patient appear to be shorter than they really are. Just has to do with the support in the skeletal system. Last term there is osteosarcoma, which is a bone cancer that is most common in children, adolescents, and young adults. Now, looking at disorders and how they could affect the skeletal system, you have three terms here: kyphosis, lordosis, and scoliosis. So you can see what the healthy spine looks like, straight down. Notice the posture in the shoulders, both are aligned, and we can expect the feet to be flat on the floor and also the level in the hands to be even. When someone has kyphosis, that's going to change their posture. Notice the hunchbackness, the large curvature in the spine. This is where patients may appear that they're shorter than they normally are, has to do with the posture. Brittle bone disease, osteoporosis, the bones lose their density. They're not as thick as they should be in supporting the framework of the body. And so you'll start to see this hunchback or the curvature occur. Lordosis is referred to as a sway back. And with lordosis, also going to see the curvature in the spine, just not as large as kyphosis. Sways more to the right, comes in, whereas kyphosis sways more outward in a circular C-like formation. And then the last one here is scoliosis. Scoliosis, if you look at the normal spine and how it's straight, with scoliosis, it adapts to an abnormal C-like type curvature. And so with that C-like curvature, what you can expect to see is the shoulders may not be aligned. Notice here with the arms, because the shoulders aren't aligned, we're seeing one arm is a little bit higher up than the other. Has to do with posture and how the spine creates the framework for the rest of the body. When there is an abnormal curvature, you're going to see it throughout the body. So this can be repaired through surgery. It is very extensive. And this is something that typically a patient is born with, and it is corrected early on. So finishing up with our last of common diseases and disorders, we have tendinitis, and there's that itis again, associated with sports-related injuries or pain that can occur within the joints, within the tendons. Inflammation of the tendons. We do have relief for this. A short period of time, maybe the patient might have to have some rest. Small at-home treatments will rectify tendinitis. Myasthenia gravis. Now, this one is interesting, affecting the musculoskeletal system. It is an autoimmune disorder, meaning that the body does attack itself. Antibodies destroy the communication between the nerves and the muscles within the body. And with this can cause double vision because the pupils, the muscles within the pupils lose their ability to be able to move the eyes the way that they should to be able to focus. Also can cause muscle weakness throughout the body, difficulty chewing, swallowing, breathing, and all because of the loss of communication between the nerves and the muscles. So the muscles don't know what to do. They aren't being told what to do anymore. So easy task is chewing and breathing can be difficult for a patient that is dealing with a diagnosis of myasthenia gravis. Very last disease that we'll talk about today is tetanus, and tetanus can cause muscle spasms in the jaw and in the neck caused by the toxin tetani, and we have a vaccination for this. Our vaccination is good for 10 years, unless someone's been put at risk, maybe through a puncture wound within a 5 to 7 year span of their last update on their immunization. We may go ahead and re-up their new tetanus so that they are protected against the toxin, but we do have the vaccination there.